Every year, the Pinal County Medical Examiner's Office, we generate an annual report, and the purpose for it is to essentially inform the public, county officials, law enforcement, medical centers, all of our partners that we work with on a regular basis, give them a glance essentially of what our caseload throughout the previous year has been, but more importantly to kind of mark the trends within the county. Motor vehicle collision deaths, suicide deaths, drug deaths, homicides, the things that we see on a day-to-day basis. In terms of the suicide deaths, we have, since 2017, we've seen an increase about 60% in the number of suicide deaths. 46 motor vehicle collisions. What's surprising about those motor vehicle collisions, of those 46, about 40% were unrestrained or not wearing a seatbelt at the time of the collision. But perhaps the one that stands out to us most and most shockingly is the increase in the number of drug deaths, specifically related to fentanyl.
So what is fentanyl? It's a synthetic opioid that it's 100 times more potent than morphine.
Fentanyl was more so prescribed for patients that were undergoing chronic pain, severe chronic pain, cancer patients, for example. Pinal County, in terms of drug deaths, has pretty much been a methamphetamine county up until last year, at which point fentanyl deaths actually took over methamphetamine as the number one substance that is common to fatal deaths in Pinal County.
More than half of them are fentanyl now.
Since 2017, the number of fentanyl deaths in Pinal County has increased 1,700%, so 1,700%.
One pill can kill.
And it only takes one time, and unfortunately, the individual ends up at our office.
Before 2019, there's no pediatric death in this county. Now we've seen 6. The 6 cases I have, 15, 16, and 2 17, and 1 18. But one child, only 1.5 years old. Children's brains, immature, are developing still. So they are especially vulnerable or susceptible to the toxicity of fentanyl being such a strong opioid medication.
You have Narcan?
Multiple agencies, Pinal County Sheriff's Office in particular has equipped their deputies with intranasal Narcan. Narcan that can be administered through the nasal passages of someone who is going through the symptoms of an overdose.
Breathe it in. Start breathing normal.
Basically acts to reverse those effects of the opiate pretty quickly. Getting the deputy on scene that has access to this Narcan can use it effectively, actually saved countless number of lives from individuals from dying and ending up at our office here, essentially. Over the counter. You can get it over the counter at your local store. So it's no longer required to have a prescription.
And those are what they call M30s.
A lot of these kids do not have a concept of the fact that if they are seeking out other illicit substances, that those substances may be laced with fentanyl. We're looking at approximately 53% of all drug overdose deaths were a result of fentanyl itself or a combination of fentanyl and other drugs.